We're so often told that the fight against cancer is a war. But what if the best strategy isn't to attack it head on, but to starve it? Today, we're going to dive into that very idea through the incredible story of a little Pekingese dog named Gureum, whose journey is really challenging some of the core ideas about cancer treatment. It all started with an absolutely devastating prognosis. I mean, just imagine hearing those words. For Gureum's family, this was their reality. Just 1 month. That's a countdown that puts everything into incredibly sharp focus, right? And when you look at these scans, you can see exactly why the outlook was so grim. The cancer wasn't just in one place, it was everywhere. This is a condition called systemic metastasis, which basically means the cancer had unfortunately spread all throughout his body. So, what exactly was Gureum up against? Let's break down the official diagnosis, because it was about as serious as it gets. Okay, so the condition was malignant melanoma, which is a notoriously aggressive type of cancer. And as we saw, it had already taken hold in his vital organs, the lungs, liver, and spleen. But that last part, systemic metastasis, that's the real kicker. It means the cancer wasn't localized, it was all over, which made the prognosis so difficult. So, faced with this awful reality, Graham's caretakers and his vet had a huge choice to make. And what they chose to do was forge a brand new path. On one hand, you have the standard route, conventional chemotherapy. It's powerful for sure, but it can be incredibly harsh, with severe side effects that could have just destroyed whatever quality of life Graham had left. But on the other hand, was a totally different approach. The goal here wasn't just to attack the cancer, but to change the very environment inside his body that was letting it thrive in the first place, all while making sure he had pain-free, happy, high-quality time.
So, how in the world is that even possible? How do you make the body itself hostile to cancer? Well, this brings us to the very heart of their strategy, the idea of literally starving a tumor.
This approach is called integrated metabolic therapy. And the core idea is really fascinating. It turns out cancer cells have this unique, incredibly greedy appetite compared to healthy cells. So this therapy is designed to exploit that exact weakness by cutting off their specific food supply. So the therapy works on three main fronts. First, you block its energy. Second, you inhibit its internal growth signals. And third, you correct the body's overall environment to make it less welcoming. Let's break each of those down. First up, blocking energy. You have to think of cancer cells like these tiny engines that are just running hot all the time, demanding huge amounts of fuel, specifically glucose and certain amino acids. This therapy acts like a roadblock on the highway, preventing that fuel from ever getting to the cancer cells, and basically starving them of the energy they need to grow and multiply. Second, you inhibit its signals. Cancer cells are constantly telling themselves to grow, divide, grow, divide. This step basically jams those signals. It also blocks a process called autophagy, which you can think of as a desperate survival tactic where the cancer cell literally starts eating its own damaged parts to conserve energy. So by stopping both of those things, you hit it with a really powerful 1-2 punch. And finally, you correct the environment. This is where it gets really interesting because the therapy takes a much wider view of the whole body. It looks at things like leaky gut, a condition that can cause inflammation, to help stabilize the immune system. The goal is to clean up the body's internal terrain, making it a much less friendly place for cancer to live. But, having the right tools is really only half the battle. The other half, which is just as crucial, is the art of smart delivery. And this quote from Gureum's veterinarian just says it all. You can have the most powerful treatments in the world, but if you can't get them to the right place at the right time without causing a ton of collateral damage, they're not really that useful, are they? This is where the drug delivery system, or DDS, comes in. It's really the science of being precise. How do you get these metabolic inhibitors directly to the cancer cells while protecting all the healthy cells around them? So the old way might be to just flood the whole system with high doses, which risks damaging healthy organs. But the method used for Gureum, well, that was a carefully calibrated strategy. It delivered just enough medication to mess with the cancer's metabolism without overwhelming the rest of his body. And that precision is exactly why he was able to stay so energetic and happy during his treatment. So, we've gone through the theory and the strategy. But the big question is, did it actually work? Let's get to the results of Gureum's remarkable recovery. Okay, so remember that initial prognosis? 1 month to live? Well, 2 months later,
Gureum wasn't just hanging on, he was thriving. His health had taken this dramatic turn for the better. And here's the hard data to back it up. Across all those tumors in his body, there was a significant 10 to 20% reduction in size. Now, for a late-stage metastatic cancer like this, that is an absolutely incredible response. But honestly, the numbers only tell part of the story. The real success was in his quality of life. The cancer-related pain he'd been in, it just vanished. His energy, his appetite, his playful personality, it all came roaring back. He was acting just like his old self again. And that, right there, was the ultimate goal. Gureum's story isn't just about one dog's amazing journey. It really forces us all to take a step back and start rethinking this whole fight against cancer idea. In this quote from the vet really reframes the whole thing perfectly. We talk so often about fighting cancer or waging war on tumors, but this suggests a totally different metaphor. It's not a battle, but a delicate orchestration. And this is what that orchestration looks like. The focus shifts from just killing the weeds to actually cultivating a healthy garden. You fix the soil, the body's internal terrain, to create an environment where those weeds simply can't grow. It's a fundamental shift in perspective. And that leaves us with this final, really powerful question to think about. Gureum's story suggests that maybe, just maybe, the most effective strategy isn't always the most aggressive one. Perhaps true healing comes from restoring balance and creating an environment where disease just can't flourish. It's a pretty profound idea,